Little or no protective equipment, fears of closing their practices. Family doctors in desperate need of masks and gowns say they're being left behind. Governor Greg Abbott says more essential supplies are coming. Earlier today, he said the state will be getting more than 1 million masks per week. The Texas Medical Association tells us about 30% of doctors make up small practices in Texas. As KXAN Investigator Arezow Doost explains, those doctors demand a better process as they combat COVID-19.
This mask.
Up until yesterday, Dr. Abilio Munoz was desperate for these N95 masks.
The last box I obtained was actually from a hardware store here in Austin because I couldn't get them through our usual suppliers.
After repeated calls and pleas, he finally got 120 of them. He's already out of gowns.
If we get sick, more people will be going to the hospitals, and then that may exacerbate the problem.
Other doctors are running out of thermometer covers, making it hard to pre-screen and check for temperatures. Dr. Erica Swegler with Beacon Family Healthcare in North Austin sent us this pic. Her staff is wearing scrub jackets and cloth masks that they wash every day. She says if she gets sick, this practice will be in jeopardy. The Texas Academy of Family Physicians has heard lots of those stories. The organization represents physicians and says the process is not well suited to distribute supplies to family doctors. The group says the supplies are getting distributed to the regional advisory councils, which are private contractors, but those supplies are going to hospitals and larger practices. The Texas Medical Association is calling the shortage unacceptable and says physicians and the rest of the healthcare team cannot be thrown into battle poorly equipped. TMA is urging construction, oil and gas companies, along with dentists and vets offices that use this type of protective gear to donate the supplies.
I think that by helping us, we're going to help also the big hospitals, hopefully try to triage the patients before they get to the hospital.
Dr. Munoz says moving to telemedicine will help with his masks, but that will only give him a few weeks. Arezow Doost, KXAN Investigates.
Arezow reached out to the state health department and our regional advisory council about the distribution process, but we've not yet heard back on that. We'll keep you posted. Our team started looking into this after a tip from a doctor. Help shape the way KXAN covers the news that matters the most to you by sending us your tips, questions, pictures, and photographs. You can do it at reportit@kxan.com, or you can fill out the form at our website. Just hover your mouse over the coronavirus tab at kxan.com to find that.